stands for chronic myeloid leukemia, and it generally arises from myeloid lineage cells. We have immature cells in the bone marrow which are supposed to mature and differentiate into neutrophils. And in chronic myeloid leukemia, these get arrested at different levels. It is due to a chromosome abnormality, what we call Philadelphia chromosome, or it's a problem between chromosome 9 and 22, which is called Philadelphia chromosome. The basic problem in CML is this chromosome abnormality between chromosome 9 and 22. But what causes that chromosome abnormality, we don't know. It may be a random event, or we know people who get exposed to high levels of radiation can develop CML. With age, there is a higher risk of getting CML. But generally, there is no family history when it comes to chronic myeloid leukemia. Like a lot of other blood cancer types, in majority of cases, we don't know why they develop chronic myeloid leukemia. Signs and symptoms depend on what cell lines get affected. Majority of patients get diagnosed at a routine blood test done for different diseases, not directly related to chronic myeloid leukemia. Sometimes patients present with symptoms of lethargy, shortness of breath, or even they can present with bleeding. In chronic myeloid leukemia, they get enlarged abdominal organs, particularly spleen and liver. So some patients present with abdominal swelling or feeling bloated, or even pain. Chronic myeloid leukemia is diagnosed on peripheral blood picture in combination with bone marrow aspirates, and particularly we look for this chromosome abnormality called Philadelphia chromosome, and newer techniques are there to quantify how much abnormal chromosome is there, or we call them PCR techniques, where we can get the percentage of abnormal gene, and these are very important when we monitor treatment. Chronic myeloid leukemia treatment was revolutionized in 2001 when they developed tyrosine kinase inhibitors. These drugs came to clinical practice around 2000-2001, but there had been a lot of trials developing these drugs before that. These are newer targeted drugs which target only chronic myeloid leukemia cells. So they are different to conventional chemotherapy. We don't see patients getting side effects due to death of normal cells. So these are targeted drugs which are supposed to kill only leukemic cells. So mainstay of treatment for chronic myeloid leukemia is tyrosine kinase inhibitors, and in Sri Lanka also there are a couple of tyrosine kinase inhibitors available, and in other countries more and more TKIs, what we call, are developed for patients who don't respond to first line treatment. As this is a chronic disease, generally it is not curable. It has to be managed properly for long-term survival. So there are first line tyrosine kinase inhibitors we use, and if there are second line, third line drugs who do not respond to first line treatment.